Hello and welcome to All the Things. I am Monique Duson, and this is the show where we talk about all the things related to God, the Bible, and real life. Welcome to Saturday. You guys, huge shout out to the moderators. Again, thank you as always for keeping the peace in the chat. You guys, tonight's show it's going to be interesting. It's going to be informative. I get to speak with a guest who's been on before and someone who I have come to really just respect and admire for her wisdom and insight into issues in regards to gender affirming care. Gosh, I'll tell you a quick story. I want to say it was last year, maybe it was the year before, whenever the Olympics were here or were happening in, I think, France or something. There was the story of the two boxers and the one boxer that, everyone thought was a male in the female category. And then it came out, this person might be intersex and all these things. And I made a comment, I made a post on Facebook about it, and normally I will tend to wait before I make posts about things. I will wait, I'll see how things unfold. But this time I didn't. I just jumped on in. I was like, this is unjust. And I just jumped on in. And then later I asked Dr. Chris if I could have a call with her because I had some questions about intersex. And so I told her about my post and she was like, yeah, take that down. Like, that's not right. You're wrong. And I was like, wait, but I thought I knew. And she's like, no, like that's not it. That's not exactly it. And actually there's about, and then she listed off this number of different possibilities of things that could be occurring. And I later had to, make a post that said, hey, look, I spoke out of turn and I shouldn't have. I should have actually got more information. This is why I tend to wait before I post things. But that's just who she is. Like, she's not going to sugarcoat things or tell you that you're right, just to spare your feelings when you're actually wrong. And I really appreciate that. I am excited to have a conversation with Dr. Chris because of just the way that she writes and the way that she thinks about these things. She is an OBGYN and she recently has written a blog on our site, on the Center for Biblical Unity site, that I will tell you about in just a little bit. But let me bring her on first to talk about some of the work that she's doing in regards to gender affirming care. So, hello.
Hello, Monique.
How you doing?
Great to be here. Thank you for your kind words.
It's so good to see you.
Great to see you.
Last time I
Great to
saw
see
you in person, we were in London at the art conference.
We
Yes.
were. That was crazy.
That was crazy, but it was a good time. It was good to be with you. So,
Yes.
for those who may not be familiar with you, please tell our audience a little bit about yourself.
Yeah, thanks. Thanks for having me. So, I am a board certified OBGYN. I live in Pittsburgh where I've worked in clinical practice for 20 years. And now I do a lot of work in the pro-life community, and I've also done some work in the gender identity area as well. Worked with some researchers on that, which we'll get into in a little bit. I am chair of the board of directors of the American Association of Pro-Life OBGYN, and then my work with the gender identity stuff has been with an organization called Reasons to Believe.
Yes.
So thanks for having me on.
Well, thanks for joining me. So you actually, gosh, I think it was unveiled, so to speak, last year at ETS or around that time is when I saw you guys talk about this publicly. But you
Yes.
participated with Reasons to Believe, or contributed, I'll say, with Reasons to Believe to create a series, I think, of different papers on, and they're more like white papers, correct me if I'm wrong, on gender issues. So transgenderism, intersex issues, and all of that. Can you tell us a little bit about that?
Yes. So actually, I led the project with Reasons to Believe. They, as you know, they're a science faith organization and believe completely in the Bible, but also what does the science say? And that's very much how I view things. Let's see what the science says. All truth is God's truth. And so they had a team of scholars, all MDs or PhDs, or other doctorate degrees. And I led that team. And what we did, we spent a long time just looking at the research, digging into all the data, all the studies. We produced a very large internal document summarizing that. And then to get that information out, Reasons to Believe publish these white papers. They're freely available on their website. This is the one, A Scientific and Medical Evaluation of Transgenderism, that discusses really the science behind gender transition. Like, is there a scientific basis? Is there evidence for people with gender dysphoria to transition? And then there's I am very sorry. One other thing you'll learn about me is I have a few cats and they ignore me except when I'm doing something very important like a podcast. So, but there's two other white papers on there. One is by Dr. Matthews on intersex because he led that area of our project. And there's another paper on the biblical biblical issues with transgenderism and evaluating that, and that's by Ken Keithley. So those, I would recommend those. They're great resources.
I found the articles very informative. Actually, I remember you sent me a section on the intersex information. We were having that conversation back, during that Olympic kerfuffle, I'll say. And
Yes.
it's just so informational. Like, there's so many more pieces to the conversation than what is being discussed publicly, or,
Yes.
what anyone I think actually realizes. And it's not just something that we can boil down to. It's either this or it's that. And it's either, good or bad. Now, yes, there are some things in the conversation I can say, you know what, this is holy and this is unholy. But some things when we're talking about, especially the intersex realm, it doesn't really fly that way. And I'm super grateful that you put me on that straight path. Now, you just released a blog on our site that dropped
Yes.
on Thursday, and it's called "Would You Rather Have a Dead Daughter or a Live Son?" Tell us a little bit about that and what went into your thoughts, even with the title. I think it was a very provocative title, but what are readers gaining in that blog?
Yeah. So the blog is very brief overview of the whole issue. And the reason I use that title is because we do hear that this is what parents are told. They take their kid to a gender clinic. Their kid wants to transition, and they may be said, "Well, do you want a live daughter or a dead son?" And what a terrible place to put a parent in. I mean, no parent wants their child to be dead. They want the best for their child. And I think when we get into discuss the mental health, we can get into this more. I think we can talk about an overview of stuff first, but it is a provocative title, but that's what people are hearing. And in fact, kids are told, if you want to get transitioned and have your parents let you do this, tell them you'll kill yourself if you don't do
Wow.
it.
Wow.
So this is very serious stuff. But the paper is a kind of brief overview of gender transition, the steps and what's involved, and the data behind it.
So
And I hope it will be helpful.
I think it will be. Make sure to check out Dr. Chris's work. You can check it out at centerforbiblicalunity.com and see her newest released blog with us, Would You Rather Have a Dead Daughter or a Live Son? Or you can check out some of the white papers and more research over on the Reasons, REASONS.org site. You'll have to put in your information, your name and email address, and then you'll get a download of those papers as well. Okay, Dr. Chris, help us understand the difference between transgenderism and gender dysphoria. And like, why do these distinctions matter? Like, we even had a conversation before we started recording where you were like, well, that's not really the name. That's really not a thing. So help
Yes.
us understand, because we believe that definitions matter. What's the difference?
Yes. Yes. And as we know, people use definitions differently. But gender dysphoria is a diagnosis. This book here, this is the DSM.
Mm-hmm.
So let's see here. This is the book that in psychiatry, any mental disorder is in this book, and it has certain criteria for meeting the criteria for that diagnosis. So gender dysphoria is a diagnosis. It has certain criteria. in this book, and I think we might get into how the terminology has changed. But basically, gender dysphoria is when a person feels incongruence or dysphoria between, I'm going to call it their birth sex. I believe there's only one, people have, there's only two sexes and genders, and they're the same. But their birth sex, how they were born, they feel differently. They feel like a different a different gender, different sex. So that's gender dysphoria. Now, transgenderism is more an umbrella term. It's actually, you could think of it more as an ideology, but often people will use the word transgender to refer to themselves. They're transgender. They feel that they're a different gender than what they were born as. They may not have gender dysphoria, but they're presenting themselves as a different gender. So gender dysphoria is a definition. Transgender is a broader term that people use for many different reasons. We often think of it as an ideology, but they are a little bit different. Although, as with many things, people use them a little bit interchangeably, but they're not the same.
Well, so you would say that someone who identifies as transgender may not actually have gender dysphoria?
That is true. Yes.
Wow. Can you help me understand, like, how would that sit? Like, are there specific criteria that would make someone who that would make someone be considered gender dysphoric while maybe not being transgender? I'm trying to make, because I've always seen it as like, well, if this person is transgender, then they must be experiencing gender dysphoria. But if you're saying
Well,
that those two aren't congruent or not always congruent, I'm wondering like how that works.
well, I think in the general use, we often think of them as correlating and being the same. And so in many cases they are. But for example, so gender dysphoria is that incongruence between your birth sex and your experienced sex for 6 months. And it's distressing. And then are some other criteria that you must meet some of, such as, wanting to be the other sex, wanting to have, you know, a body of the other sex, things like that. So that's gender dysphoria, but you may have a young person who finds out that, oh, it's really actually pretty cool to be transgender. So I think I'm going to do
I
that,
get you.
where they didn't necessarily have all those criteria of gender dysphoria.
Hmm.
Now, certainly there are plenty of people who would call themselves transgender who do have experienced gender dysphoria. But, it's like anything, everybody's story is different.
Yeah.
And
No, I that when you said, the maybe part of that social contagion that, I'm in ninth grade and it's really cool to,
yeah,
identify along the spectrum. They may
yeah.
not have had some of the criteria or some of the pieces that meet the criteria for the
Yes,
actual diagnosis. That makes sense. Thank you.
correct. Yes.
When you are looking in the DSM and you see gender dysphoria, is gender dysphoria a term that you see as changing or having evolved, like, since the DSM, like, 3 or something like that? Or do you think that it's been pretty congruent throughout the entire conversation of gender dysphoria, and as people, continue to seem to come out as gender dysphoric more and more?
Yes, that's a good question because the terminology has changed. Remember that, and we can get into this more, but 30 years ago, this was very rare. 20 years ago, very rare. And so the term, any term related to this wasn't even in the DSM until 1980. And the term was transsexualism. And then in 1994, the DSM called it gender identity disorder. And then that was changed in 2013 to gender dysphoria. Now, when you go from gender identity disorder to gender dysphoria, you're dropping the word disorder. And some of what was behind that is that they were trying to normalize it and say this isn't really a disorder. Of course, it's in a book of psychiatric disorders. So, of mental health disorders. So it has to, I think, it has to be in the book to have a diagnosis, to have insurance coverage in some cases.
Hmm.
The DSM also, so the current version is DSM 5, and then they did another revision. So it's DSM 5 TR. And in that latest version, in addition to that gender dysphoria name, they changed some other terminology. For example, instead of desired gender, they changed it to experienced gender.
Oh, wow.
Instead of natal female or natal male, how you were born, it was assigned male or assigned female at birth. So instead of saying you were born a female, they're saying you were assigned the gender female at birth. Now, I take issue with that as an obstetrician because I have delivered thousands of babies. I have never assigned a sex. I announce it, I identify it. It's a boy. I'm not assigning anything. It's pretty obvious to everyone in the room what the baby is. But they are now calling that, and you will see that in the literature, in medical papers, assigned male at birth, assigned female at birth. But so that's some of the other terminology that's changed. But get back to your original question. Yes, the term has changed from transsexualism to gender identity disorder to gender dysphoria.
Wow. Well, that makes me think of things like rapid onset gender dysphoria. And if that is something that is covered in the DSM as well, or when we think of, all of the disorders, because you said, like it's in a book with mental health issues and mental disorders. When we think about rapid onset gender dysphoria, are you seeing this as like a new phenomenon that has come on, like a social contagion? Because I call it a social contagion. I don't know if that's a fair term to give it, but that's kind of how I see it. And I'm wondering if that's something that you're seeing as well.
Yeah, so let's talk about rapid onset gender dysphoria. That term is not in the DSM. Those Many people don't like the term. The people who are uh, in the transgender community or promoting that kind of work many of them would take issue with that term. Now, that term was recently coined. A physician did a study. She actually interviewed parents of kids who were coming out as transgender, and she noticed this phenomenon that this was a different group of kids. So let me backtrack a minute. And if you go historically 20 years ago, this was very rare. Transgender, transsexual, gender dysphoria, any of those were rare. And it was usually seen in two distinct groups of people. The first group was young boys, like toddlers, 3 and 4 years old, who exhibited gender atypical behavior. What I mean by gender atypical behavior is maybe they liked pink, they liked to play with dolls, they maybe were kind of feminine. And actually, with those boys, if they were just, given supportive and love and not transition, with time, as they went through puberty, most of them became comfortable with their sex, with their birth sex. And the other group, so we have these young male children. The other group was adult men who may have been married and had kids and then transitioned to a woman. We think of Bruce Caitlyn Jenner. We think of Rachel Richard Levine. These are common examples. So again, historically, this was very, very rare and really only in very young boys and adult men. And now, so Dr. Littman, what we're seeing now, like in gender clinics, is just this rapid increase. We all know it's much more common, somewhere maybe 3 to 5% of kids in some reports identify as transgender. But what Dr. Littman found was that there were different characteristics. These adolescents, young people who were expressing discomfort, identifying as transgender or as the other gender, they exhibited different characteristics than these groups we saw before. They hadn't struggled long term. Now, again, this is a generalization. There are always people who don't meet this category. But what she found in large part was that a lot of these kids, they hadn't struggled long term. It was just sudden onset. That's why it's called rapid onset. Like everything's going fine. They're living their life. If the parents think everything's fine, and then the girl comes home from school and all of a sudden says, well, I'm a boy, with no, the parent had no idea there was any issue. It wasn't like this kid had struggled their whole life. So this was what Dr. Littman was seeing, this rapid onset. And so she got some data on all this, and she did find that there were some characteristics of this group of people. And it was, first of all, mostly girls, for about 2/3, I think, girls. So more girls than boys. They had a higher incident or higher involvement in recent social activity. They were involved in groups where there were other kids that may have identified as transgender. The parents felt that they were taking terminology they got online. They were coming home with it. That's like this, well, tell your parent you'll kill themselves if you don't, transition. So she coined the term rapid onset gender dysphoria, meaning adolescent onset rather than young child or adult, and rapid onset, meaning not having a lifelong struggle with gender. And so this is when we see the transgender issues today, that's largely what we're seeing is this rapid onset gender dysphoria. And there is, studies have shown a relationship to increased social media use. And, I just heard someone telling their story the other day where, they didn't really fit in. They were, I don't know, 9, 10, this was a boy. He liked a girl and she didn't like him. And so, but he went online and he found this community online, and everybody's telling him, we'll transition, become a girl, and then everything will be okay. And so that's just an example. Everyone's story obviously is different, but again, getting this information from an online community is, for many people, part of it. And so, yeah, that's kind of that's where the term rapid onset gender dysphoria came from. Now, Dr. Littman, her paper was retracted, or her organization, or I think her university issued an apology. There's all this backlash from this paper, even though, her data was, and the paper was well presented, well studied, but not everyone would agree with that term. So it's not in the DSM.
So what I hear you saying is that when it's more of or I guess, gosh, with rapid onset gender dysphoria, it shows up primarily, or it has shown up historically, primarily in adolescent females. And there is, I guess, some correlation between social media use, peer group, and the girls who are now saying, hey, look, I think I'm experiencing this gender dysphoria, or I am transgender. Whereas what may show up more as, I don't know if we want to call them mental health issues, but when you're talking about the young boys and the older men, this is something that seems to be more of like a lifetime struggle. Is that correct to say?
Yes, or if not a lifelong struggle, well, certainly probably for the little young kids, but it's not a lifelong struggle, a long struggle.
Yeah.
And again, there probably, I'm sure there are adolescents who have had a lifelong struggle, but there are also, seems to be a lot of them that this is a more rapid issue. And unfortunately, so a lot of these kids, there's a higher incidence of depression and anxiety, of trauma, of bullying. There's a higher incidence of autism. And so these are kids that are already struggling. And sometimes they're under the impression, or they're told, whether it's by their friends or by a doctor, or just that's their impression, that if they transition, things will be better. And many of them find out that it doesn't solve everything. For example, think of a young girl who is assaulted in the bathroom by a boy. And so she feels very vulnerable as a girl. She doesn't feel secure as a girl. People have reported that, well, if they change and be a boy, then they're safer. We've heard people say that. And I think about, you think about your own puberty. I mean, nobody really likes being 13, 12, 13 years old.
Hard age.
We all felt insecure. But what if this was around and we were offered that, oh, well, maybe you're transgender? Well, how many of us would have
Yeah.
thought that was, you know,
Well, and
our
it's like, well, maybe you're transgender. Okay. So you go from, hey, I'm uncomfortable in my own skin and social media says this. And so now I'm questioning, maybe I'm transgender. So then maybe I'm already in counseling, or maybe my parents put me in counseling. And now it's like, go to the doctor, tell them that, you think you'll die, and bam, puberty blockers. It it seems like that would take a lot of steps to get to. Like, it shouldn't be 1, 2, 3. It should be like 1 to 1,000. Am I right? And just what I think I see is that it's a very quick process, or it can be. I mean, maybe not for everyone, but
yeah.
it does seem like it can be a very sped up process to go from some form of rapid onset gender dysphoria, some kind of, hey, maybe it's a social contagion, maybe it's the influence of peers and social media, to, I think I need some form of, advanced gender affirming care.
Well, that's what you're talking about, gender affirming care. Now think about that terminology, gender affirming, meaning you affirm the gender. So normally in something like this, whether, let's say someone presents with some struggles with their gender 10, 20 years ago, or with any issue or that someone presents with. As a physician, I need to first do a thorough evaluation. We need to look at all the underlying issues. If a woman comes into my office with some bleeding problems, I don't automatically take her uterus out. We figure out what's going on. We 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 figure out if we can, fix it with less invasive management. But what gender affirming care, which is now the model of care that is used in most gender clinics affirmed by major medical organizations, is that if a person, and let's talk now just about adolescence, a young person goes and says, a young girl says, I'm a boy, then the doctor is required to affirm, yes, you're a boy. So here you go. Let's block your puberty, then cross-sex hormones, and then possibly surgery. And as a physician, no matter, even if you thought that transitioning was okay, that's not good medicine. We don't go to the most invasive intervention first. We don't do anything without a thorough evaluation. And again, many of these kids have underlying, whether it's health issues or bullying, or what about this girl that got assaulted in the bathroom? Well, what about helping her deal with that assault and addressing her mental anguish from what happened and helping her to feel secure rather than, okay, just be a boy? So, we need to give people the best care and see the whole person and all of what's going on, and not offer transition as a solution, because as we might get into later, the science doesn't show that this solves any of their problems, doesn't provide any benefit.
Well, and that was the next thing that I was going to ask you, is what is the science, and what is the support or lack thereof? But before we do that, I do want to talk about just a few definitions, because we've introduced some new words that I'm not sure everybody is going to be familiar with, and I don't just want to assume. But when we're talking about sex, we're talking about biology. When we talk about gender, okay, so your sex, this is what you are born with, right? And I'm just making sure that I'm right. So yeah, let me ask you. Okay, because I don't want to get out here and start giving people my definitions. I don't know much. When we talk about sex, what goes into saying this is your sex? I always say sex aligns with biology, but there's a lot of biology that goes into that. What goes into to sex?
Are you talking? Well, we can talk about the embryology, and I think that would be important, but let me just talk about definitions.
Mhm.
So let's agree sex is biology. He's born with a penis, he's a boy. Let's call that biology, let's
Yeah.
call that sex. Now, my position is that sex and gender are the same thing.
Yes.
Some people would say that gender refers to more the expression of one's sex. It's hard to define gender in that way without using the term gender. So, for example, so yes, even though, but some people then on the, I would say on the other side, like the pro-transgender people, you will know this better than me, Monique, who these people are, because you're more into the philosophy and all the that undergirds this. But some of those people that behind this movement completely separate gender and sex, so that there's a continuum between them.
Yeah, and that
So that
sex is not that while you're like you're saying sex is what happens in the body. Sex is our biology, but gender is what happens in the mind. That's a lot of what I hear that, the way that I feel, what is happening in here and in my heart might be different than the bodily organs I was born with, might be different than my biology. And this is why we have to have a conversation about gender and gender expression and gender identity. But there are arguments too, and I would love to know if you've seen this, of this separation of my gender identity with my gender expression even.
so you're getting into difficult terminology.
It is.
Tw- you know,
It gets a little murky.
20 years ago, if you filled out a legal form, name, address, gender, name, address, sex, you would fill out the same thing. You wouldn't think anything about it. Because gender and sex meant the same thing. And I will tell you, it's important to understand as a Christian that there are only two sexes and that gender there are different expressions of one's gender. For example, a girl who's a tomboy, she likes to play sports, she might be a little more masculine perhaps than her her friend who likes to wear frilly dresses, but that doesn't make her any less of a girl. And some would call that gender expression. I personally have trouble. I take issue. I personally believe that would call gender and sex the same thing. There's gender expression. There's discomfort with one's gender and things like that. But I do have colleagues in the project that I worked on, good Christians who would say they're not the same, but they have to be connected. But we all agreed that although there can be a spectrum of gender expression, there's not more than two genders, and there's not more than, there's two sexes, two genders. So I think the problem is the young girl who's a tomboy, or then she questions her gender because, well, I like to play with the boys. I really don't like dolls. Is something wrong with me? Maybe I'm a boy. And instead of transitioning her, she should be assured that that's okay. It's okay for we don't have to fit into these stereotypes. I guess is what I'm saying. I was better at math, and that didn't make me masculine. That's okay. You know, and so I think there's a lot of things there that people need to understand. I think we need to reassure people, especially these young kids, that instead of, oh, you feel uncomfortable as a girl, so why don't you change over, which you can't really do anyway, assuring them that they are made, God made them, and God didn't make any mistakes, and they're fine how they are. You know, and dealing with whatever issues are behind that, the getting assaulted in the bathroom, or the trauma, or the issues in their home, or their depression, or there's a higher incidence of autism. I mean, these are all struggles that need to be addressed, but transitioning doesn't fix them.
Have you ever wished you could be in a room full of like-minded women who love Jesus and are passionate about standing firm in the reason for their faith? The Women in Apologetics Conference on September 26th and 27th in Grapevine, Texas is your chance to do just that. Inspired by the book of Philippians, our conference theme this year is Christ proclaimed side by side, and will encourage you to proclaim Christ out of goodwill for others and your love for God. Expert speakers including Nancy Piercy, Krista Bontrager, and several others will address challenging cultural and theological issues, including church hurt, justice issues, the hiddenness of God, sexual identity, and more. This is a live in-person event only, no live stream. So don't miss out. Come for the wisdom, stay for the fellowship with women from all over the country, and leave encouraged to stand firm in the gospel. Grab your tickets today at womeninapologetics.com.
Two more words that I want to make sure we all are on the same page with is puberty blockers versus cross-sex hormones.
Yes. Well, let me talk about kind of the steps of transition. We think of there being 4 steps. So those 4 being social transition, puberty blockers, if someone has not gone through puberty, then cross-sex hormones, and then surgery. Now, people who transition may do all of those, or they may just do some of them. So the social transition, the first step, is wearing the clothes of the opposite sex, taking on the name and pronouns, and maybe cutting your hair differently. A girl may cut her hair very short in a boyish style, things like that. Social transition. That goes beyond, where girls are doing binding of their breasts and hiding, boys are hiding their genitals and tucking them. And so there's social transition, which in and of itself is not without consequence. So that would be the first step. Then the next step, if a child or young person has not yet completed puberty, they may go on puberty blockers. So when someone goes through puberty, a girl, her body will produce estrogen, and that will form her secondary sex characteristics, her breasts, the secondary sex development, starting her periods, etc. A young male, as he goes through puberty, will produce testosterone, and that produces the deep voice, the hair growth, etc. So what a puberty blocker does, it stops that hormone, the proper hormone, from being released. And then the cross-sex hormones gives them the opposite hormones. So a girl who wants to be a boy, and girls go through puberty at 9, 10 years old, or start puberty. So, and these can be given right at the start of puberty. So think of a girl, she's 9 years old, she's having some distress, she decides she wants to be a boy. Gender-affirming care. Okay, well then you're a boy, 9 years old. Okay, let's stop your puberty. Give you this injection of called leuprolide acetate. This is I use this medicine as a gynecologist for endometriosis and for fibroids. It has a lot of side effects. It basically puts people into a medical menopause and hot flashes. And I mean, my 45-year-old patients don't like this medicine. We use it for 6 months only. We don't use it long term. So now you're giving this to a 9-year-old. So she doesn't produce estrogen. And then she doesn't form breasts. She doesn't, menstruate, etc. And then the third step, cross-sex hormones, is giving her testosterone. So you're giving her a boy hormone so that she'll start growing facial hair. She'll get a deep voice, etc. She'll get bulked up, more muscular and angular. and things like that. And so that's the cross-sex hormones. So that's the difference there.
Wow.
Now, if someone was, say, 20 years old and decided to transition, they may or may not, well, they may take the puberty blocker to block the release of their own hormones, but they've already gone through that puberty. But in young people, it's really to stop the normal process of puberty.
Now, let's talk about, now that we have the timeline and how these things work together and what these words mean, what is or is there any supporting evidence for the use of these things, either like to support the fact that, hey, these transitions really do, help increase the human flourishing, or the life longevity of this, person who wants to transition. They're happier at the end, their mental state. So if they are struggling with bullying, they're, no longer being bullied. They have more of a self-confidence and self-awareness, or they're no longer struggling with anxiety or depression. What are some of the studies and the evidence that's been done that support the need to transition children? Or maybe there is
Well,
none, and maybe it's just a lack of.
Monique, I was thinking in answer to your question, I should just remain silent because you said, what is the evidence? There isn't. I should explain that. So I have spent hundreds of hours studying the evidence, pulling the studies, looking at them, evaluating them. There are tons of studies out there. It's not that there aren't studies. But, in medicine, you can make a study to show anything. So you have to look at the quality of the study. Is it a randomized controlled trial? Does it have a placebo group? What was the dropout rate? A lot of these have a high dropout rate. So you can say, I mean, this is the same in a lot of the studies on abortion. So if you don't know what happened to 20% of the people that started the treatment, it's really hard to say what your outcome is because you don't know that 20%. So as we look at these studies, they are low quality studies, and they do not. There are no high quality studies. There's no good data to show any benefit. In fact, what started the puberty blockers is what's called the Dutch protocol, and these were some people in Holland. Researchers and clinicians. They saw these kids with gender dysphoria. Now, these were kids with different than what we see today, but these were young people with long-standing gender dysphoria. And they took 70 of them, and they gave them puberty blockers. And then they reevaluated them. And in some areas, there was if they looked at, depression, gender dysphoria, and behavior, other things. And some of those improved and some didn't. And so they said, oh, well, look, we're going to do this. But here's the thing. On those 70 kids, they also got psychotherapy. There was no control group. What would have happened if they got nothing?
Yeah.
What would have happened if the group got psychotherapy? I'm sorry. They didn't compare puberty blockers to psychotherapy to placebo. They just had puberty blockers and they got psychotherapy with no comparison. So first of all, which helped, the puberty blockers or the psychotherapy? And what would have happened if you did nothing? And it's only 70 kids.
Yeah.
They're not the same population we see today. These kids had long-standing gender dysphoria. They had to have their mental health issues, under control, etc. But then the Dutch study continued their work, and they looked at, okay, let's look at them, give them puberty blockers, give them cross-sex hormones, and then surgery. And they looked at them after each of those stages. And they again concluded, oh, look how much this helps. Well, of those 70, in the second study, there were only 55. So 15 dropped out. Over 20% were not included in their results. And one of them died of the surgery. One of these young people died actually shortly after surgery of a surgical complication of infection. So they didn't include that person in the outcome. So that's where this all started. The study's never been replicated. In fact, that has been claimed by those researchers. They have admitted it's never been replicated. And even if it was, I mean, we don't know what would have happened. What would have happened if these kids didn't transition? We don't have a comparison group. And what's happened now that we see is, we have seen this in Europe and other countries where even the people involved in gender transition care are realizing the data is not there. There is more harm than help from transitioning young people. It's not good science. It's not good for these people. And these countries are pulling back. And we have we have not seen this in the US until recently. The administration did a deep dive and just last month published a review of the evidence with similar findings. So yeah, there is not evidence that this is beneficial, and there's clearly evidence of harm. I mean, these are permanent alterations to people's bodies.
I'm glad you mentioned the Dutch study because I was going to ask you, why are so many countries, it seems like over in Europe, seeming to pull back from this
Right.
gender affirming care? And what I hear you saying is that there isn't the evidence. And I'm not sure if, there are multiple people who are dying from this, gender affirming care, or if they are, struggling in ways that maybe they didn't struggle before. And now it's a whole new set of issues. Is anyone doing research into that at all?
Well, there's a ton of research. I mentioned the Dutch studies because it's the first one. That was where it started, the Dutch protocol, and people know that name. But there's been hundreds of studies looking at things. But again, they're not high quality studies. There's things that, because of not having the right criteria in the study or whatever, or study design, various factors, you can't draw conclusions. You can't draw the conclusion that this is beneficial. And again, this all started in Europe. It usually starts in Europe, and they started the Dutch study. And then all of a sudden, 10 years ago, there's we see all these kids transitioning and clinics opening up all over, our country and everywhere to transition kids. And then we see the Europeans, as more studies are coming out, realizing none of these studies are high quality, and that these things do more harm than good. There was a article, I think it was about a year ago, in the Wall Street Journal, signed by, I think, 21 clinicians, people who do transition kids, and researchers, so doctors and researchers from multiple countries, mostly in Europe, I believe, saying, hey, we've done this care, we've done transition, and we need to take a step back, because the best first thing for these kids is not transition, but psychotherapy should be the first step, and we need to back off. We don't have the data.
What are we seeing, or what are you seeing? Like I'm in it together. Let me stop. What are you seeing in regards to detransitioning? Because I only imagine that if people are beginning to say, well, you know what, we don't have the research that we need,
Right.
detransition stories, and from what I see, detransition stories seem to be on the rise. Are you seeing a lot of detransitioning stories? Maybe even let's start with a definition. What is detransitioning?
So detransitioning, so someone transitions to the opposite sex,
Which
and
means
then
they
they
go through the
decide.
surgery, correct? So they've completed that fourth
Well,
step?
it could be anything.
Okay.
Not everyone goes through the surgery. Some people go through just the top surgery, not the general surgery. So, not everyone goes through the full gamut, whatever. But there's they've transitioned in some way. So
Okay.
detransitioning would be they decide to go back. So they will, as much as possible, it can't all be reversed, but say the young girl who wanted to be a boy, well, she's going to stop her testosterone. And, but if she already had her breasts cut off, she can't get them back. I mean, she can get implants, but she'll never be able to breastfeed. There's a lot of this that is not reversible. So we do see increasing stories. We don't really know the percent of detransition. It's hard to say. It's actually harder to get the care for detransition. If you look at the guidelines by the World Professional Association for Transgender Health, if you want to call them a standard of care, I don't agree with what they propose, but they make it harder for someone to detransition. You need 2 referral letters to detransition, which you don't need to transition.
Oh.
So, but we hear a lot of stories. I'd love to see you have one of them on your podcast. But Chloe Cole, Laura Perry Smaltz, I mean, these are people that realize their troubles, their difficulties were not dealt with adequately, and that this was not the solution, and that God didn't make a mistake when he made them. And so that's a detransitioner. However, people also detransition for different reasons. There may be people that, detransition because their family doesn't like that, or, maybe they're not changing ideologically or something. But so that's detransition. We don't know the percent. I think that the general feeling is that it's certainly on the rise. But each of them is a, difficult story. That's a person that's struggling, that made a really big change. It's irreversible, and trying to make their way back.
I it's hard to believe, although it is very believable, especially in our current culture, that those who are responsible for transitioning and creating some of those policies and guidelines and, all of
Mm-hmm.
that would make it more difficult for someone who wants to detransition. Seems like everything is pushing people, especially young people, to transition. But something that I learned very early on, when I was studying social work, is the thought of doing no harm. This idea of, we don't want to do any harm. I don't want to do no harm to my client. And so that's the very first principle. How do I look at a situation and evaluate the best ways to do no harm to a client? And
Yes.
so when I think of the idea of do no harm in the medical profession, one, from my point of view, I see harm being done in the idea of transitioning young people and
Yes.
starting children on puberty blockers. But then it seems like the idea of do no harm, when they want to detransition, there's this double downing of, well, we're going to do even more harm by making it more difficult for you to detransition.
Yeah. Yeah. The do no harm is important, and that's obviously ingrained in my medical training. Do no harm. If I can't help someone, or you don't just do an intervention to do an intervention. You never do something that, the benefit always has to outweigh the risk. So there's actually 4 ethical principles we typically abide by in medical ethics. And one is to do good, not to do something that has benefit. Well, the second one is to do no harm. The third one is the patient has autonomy, but to have autonomy, they need to have fully understand what they're getting into. And then the fourth one is justice, treating people fairly. Well, let's talk about the first 2. So do no harm, do good, and do no harm. Now, every intervention or surgery or medicine has risks. There's harms that come of treatment. But for example, if we have a woman with breast cancer and she's going to die if she doesn't get a double mastectomy, or we're going to extend her life because of a double, and chemotherapy, well, that's a surgical intervention that has harms. Chemotherapy has harms, somebody with cancer, but you weigh that against the benefit of this curing their cancer or treating their cancer appropriately. So you have to always weigh the benefit and the harms. So where your overall balance is a benefit to the patient. So if you look at gender affirming care, do no harm. Well, there's clearly harm. These kids are sterile. They're have irreversible genital and other mutilation, um, bone density issues, neurological effects. I could go on and on. So there's definitely harm, and we've shown no benefit. So, it's not the same giving chemotherapy to a cancer patient to treat their cancer has some risks and some bad effects, but the overall outcome is a benefit. Whereas in gender affirming care, has been shown to be no benefit, and there's definitely harm. And it's concerning that this is where we're at in the medical community.
It is. It's definitely sad and concerning and infuriating, especially when you think of parents of young people who
Yeah.
are wanting to, transition, whether that's
Yes.
they're, 12 and now they want to stop their puberty, or,
Yes.
start these puberty blockers and things like that. It's confusing. And then
Yes.
when you go to your pediatrician to get help, or you put your kid in therapy or things like that, and all of the push is to, to affirm their feelings, affirm their gender, affirm the mental disorder that they might be struggling with, rather than sitting down and having conversations of truth. It's really, really hard. And sadly, we're even seeing this in some churches. It's tough. It is tough.
Yeah.
Get off on the sidewalk, please. Demonstrators clashing with George Floyd. Parts of the
now turning deadly. Anger.
What does it mean to be a Christ follower in this cultural moment and have biblically centered conversations on race, justice, and unity? I want to bring it around to Christianity, to church, to scripture, and I want to get your thoughts on truth and identity and like human dignity, and Christians navigating this, parents who are navigating this. How can Christian parents navigate this issue with their children biblically, truthfully, honoring their dignity and identity? It's tricky. And I know that this is a big question. You might just be like, it's time for me to log off. I don't know.
It is a big question, but there's a lot of people facing it. So if we look at the biblical truth, God made man and woman. God made us in God. Man has been made in the image of God, and he made two sexes, male and female. And you can't change your gender, your sex. So, but these parents are seeing, these kids are coming home, these kids are struggling. So what, I think we have to, and with anybody, I think, I sit here as a physician and a researcher, and I'm talking about the science, but these are people. And, I can talk about the science kind of disconnected and talking about it factually, but I have a friend who's transgender, and it's completely different. This is my friend. This is a person more of an acquaintance, but I want to love this person and care for them and understand their struggles. So I just want to clarify that from the outset. And for a parent, with a child that comes home, there's just a few things I would say. you could have a whole 100 podcasts on it, but it's going to be a long road. Take the long road, and do not let your kid transition. Find a therapist who is not going to send your kid to gender right into transition. A lot of it, there's a lot of connection with social media. For some kids, it may be taking them off of social media. Some parents have reported having to just take their kids out of that school and move away. I mean, your kid's life is at risk here, and it may take some very serious things. I would recommend, can I recommend a couple resources?
Please.
I think one thing that I recommend for parents is to educate yourself. Read all you can. There's a lot of good resources. One of them is Lost in Translation by Miriam Grossman. She presents a lot of the data, and in the back of her book, she has a lot of good resources for parents and for dealing with that. And the other book I would recommend is the book Irreversible Damage by Abigail Schreier. And she talks a lot about rapid onset gender dysphoria and all the things playing into what's going on with these kids and how to get them out of that. So I would recommend those two books. These aren't Christian books. I would, but they are, all truth is God's truth. And, I'm not selling the books or making anything from them, but they are books that I personally have found helpful and to be very informative and truthful and well documented. So yeah, it's back to the question, would you rather have a dead daughter or a live son, if we could go back to that? So these kids, again, yes, transgender young people are at higher risk for suicide. They also have higher incidence of anorexia, depression, autism, anxiety, and people with those issues also have higher risk of suicide. But it has not been shown that transitioning decreases the risk of suicide. In fact, one of the few long-term studies in the area, now this was on adults, but it was a long-term study and people that transitioned, showed that in the long term, those who transitioned had a 19 times risk of suicide. So yeah, we always, it just breaks your heart to think of a young child taking their life. And kids who identify as transgender certainly are at risk for this, but the transitioning doesn't decrease that risk.
How can churches support parents? Like, I ask this a lot. If a guest ruled the world, if Dr. Chris ruled the world, how would you instruct or encourage churches to support families who are in the middle of this painful and chaotic time with a child who may be, struggling with true gender dysphoria, or maybe they're, experiencing rapid onset dysphoria and not really sure what to do?
Yeah, that's a great question. That's a hard one. I would say, first of all, and we see this in a lot of issues. Some churches ignore issues so they don't have to address them, talk about them. Some churches compromise on issues. And then some churches maybe take the right view, but aren't always kind about it. And churches aren't perfect. And there's probably a few churches out there that do it right. But I guess I would just point to Dr. Keithley's paper with Reasons to Believe about the biblical view. And he talks about how we should be welcoming, but not affirming. So we need to love these people. We need to welcome them into our community. We need to love them and walk alongside them. That doesn't mean we affirm their transgender identification or affirm, the whole LGBT thing, but we love them. And how to equip churches, that's a big question, and obviously depends on maybe different for a smaller church of 100 people versus a church that has thousands of people and more resources. Um, but yeah, I mean, the issue is out there, and um, yeah, maybe it's doing starting with a book study. I'm just throwing out
Yeah.
ideas because I don't really know. But take one of these good books and study it, or um, bring in people to speak on it, or
Yeah. No.
I'd be interested, Monique, what if you have thoughts on just overall how a church tackles an issue like this.
Well, I do think that, doing a book study on these issues is really important. Bring your people up to speed on what is happening in our culture. And that doesn't mean that we take away our time, of worship from God on a Sunday morning, but we
Right.
do, as best we can make these things available so that people can stay abreast of
Hmm.
what's happening. Um, I would also say, same with like you're saying, bring in a speaker or, find some YouTube videos. So then you don't even have to spend any money if you're a smaller size church or a church who may be struggling financially. Find some YouTube interviews, kind of like this one, or check out Beckett Cook's podcast or Christopher
Yes.
Yuan, like Juice and Rosaria Butterfield.
Yes.
Um, you know, we can equip people because there are resources out there because of things like the internet and because of conversations like these. But then I would
Right.
also say, and especially because I'm thinking of what's happening right now in Colorado with their new transgender bill. I'm just going to use that word. It's not really what it's called. It's like AB 1325 or something like that. But begin to put together a list of resources and support. So, who is the child psychologist in my area who's a Christian who is
Right.
not going to, tell my child, well, yeah, little Sally, your name really should be Scott? How, but that's not going to be everyone.
Right.
That's not going to be every child therapist. That's not going to be every Christian
Right.
child therapist. So, start
Exactly.
a list and
Yes.
start to cultivate that list. So when people come in and they say, man, I'm really struggling with this, you can say, hey, look, on
Yes.
the low, I know this, but this person, we don't advertise a lot. She's not very vocal about this information, but she will see your kid. We need to start having people
Yes.
who will take the moral high ground and say, "Look, I know what the law in my state says, but I'm going to
Right.
do the righteous thing anyway." I would say another thing that churches can do is get acquainted with people like Alliance Defending Freedom or
Hmm.
the Pacific Justice Institute, people who are tackling some of these issues. I brought up Colorado because Colorado recently passed a bill that says if you dead name or misgender, dead name is using the name of the old name. So if I was born Chantal Monique Duson and now I want to go by Joseph Robert or something like that. You see me on the street, or if you're my parent and you call me by Chantal Monique, that can be seen as a discriminatory act. And
Right.
so how do we connect with organizations that will help defend parents if their children come up and say, "Well, my mom and dad participated in a discriminatory act toward me." How do we connect with
Right.
organizations when parents who may be going through divorce, perhaps dad is for the affirmation of, the gender ideology and the mother is not? This has created a rift. We are getting divorced. In Colorado, the parent who affirms is the one who gets more ground.
Right.
They get
Right.
the preference. Who's going to help this mom on this side? Who's going to
Yeah.
help her shoot her shot for her kid? And so we
Yes.
need it's not just it is about counseling. It is about walking a road with people. We need to bear with one another. We need to walk together
Yes.
with people in their pain. I am here for it. And yes, we also need to think strategically about how we are setting people up to fight for their kids. We fight in
Yes.
prayer. I am there. I am so there. But I also every once in a while might need to throw my hand. And I might need to, you know what I mean? Like we need to come in organizationally and be strategic Not
Yes.
just thinking that, well, that's the law in my state, and so there's nothing I can do. I am not on board with that. So those are a few of my thoughts.
Yeah, those are great. And I was just thinking, wouldn't it be great if in a community, if churches could uh, get together, meaning, hey, maybe the Baptists and the Presbyterians don't believe on baptism, but maybe they can, if they, are Orthodox believing churches can share some resources and whatever, it's a lot. I just think pastors have so much more to deal with now than they did in the
It's
past.
so true.
But
It is so true.
but these are big issues.
Gosh, they really are. I want to close with one thing that you said, and then allow you to offer some encouragement as well. But you mentioned a little while ago, that we welcome, but we don't condone. I may be misquoting you, but it was like I
We
welcome,
don't affirm.
we don't affirm, and that we are wanting to walk the long road.
Yes.
And I think that's so important to remind people that,
Yes.
we do want to, Krista would say, we want to win the next conversation. We don't want to
Right.
blow up the relationship so much that now we can't even get to the next conversation, because you might actually see movement or a shift of heart in that next conversation. And so that's what it made me think of. Like, we need to be willing to walk the long road as we are prayerful, as we are in our word, as we are surrounded, especially if if you're a parent going through this or something like that, surrounded by people who are praying for you, who are willing to walk
Yes.
this road with you. But what encouragement would you leave to either the person watching who might be experiencing that you know, gender dysphoria, or to the youth leader or the parent who might be walking a road with someone who is
Yeah.
experiencing gender dysphoria?
Those are great. I think to the person who's struggling with gender dysphoria, I would just want to say God loves you. He loves you as you are. He died for you. And you don't need to be somebody else. You're, who you are is great. And yeah, we're all a work in progress, but there's nothing wrong with you intrinsically. And, you know, I would encourage that in those people, and to, what was the other group? Pastors and parents.
Yeah,
I would
because they're
say,
they're in it too, you know what I mean? Like
yes,
the youth
yes, they
pastors,
are.
yeah.
Well, I would say, speak the truth in love. It's be welcoming, but not affirming. So we have to always speak the truth. It's not truth to say, sure, Mary, it's okay for you to be John. That's not truth. That's not, and it's not loving either to this person because it's not helpful. But we also have to love people. And it's not about making a judgment and moving on. It's about walking through life with these people. And, when I talk to people, it does seem like most people know somebody in their family or their friend group that is struggling with this. Well, walk alongside that person, be their friend. That doesn't mean you have to agree with what they're doing, but show them God's love. And I think that's what I would say. I think that's important.
Awesome.
Just go back to the truth of Scripture, speak the truth in love.
Dr. Chris, thanks so much for having this conversation with me and for helping us to understand some of these distinctions. You know, there was so much that I did not get to ask you about.
Yeah,
So maybe we'll have another conversation.
great.
Where can people follow some of your work at?
Yeah, thanks. Well, I would say thanks so much, first of all, Monique, for having me. It's always good to talk to you anyway, but great to be in your podcast again. I would direct people for all those papers that Reasons to Believe has produced that I worked with and led the team on. If you go to reasons.org, it should be on the upper right, and there are 3 papers there that have a lot of information, and I think you would find helpful. And so that would be the first place I would direct people to.
Awesome.
And yeah, so thanks.
Thank you very much. I appreciate it, and I will talk with you again soon, I'm sure.
Yes. Thanks so much. So great to see you.
Thanks. Bye.
Thanks for having me on.
Thanks. You guys, there is so much information that we just didn't have time to get to. And yet the conversation and the information that Dr. Chris brought is still so helpful. Thank you guys for watching. I cannot wait to have Dr. Chris on again. Please go and check out her blog that is on the Center for Biblical Unity website. You can go to Center for Biblical Unity, all spelled out.com, and check out her blog. Would you rather have a dead daughter or a live son? But you'll want to check out the data. You'll want to check out all of the information that is happening in, the world of transgenderism or gender affirming care. It'll be a short and easy read. Also, check out her work at Reasons to Believe. You can go to reasons.org for that. You'll just put in your details and then you'll be able to download a PDF of the papers. Again, it's tons of information, but it's all very good. And some of it is pretty surprising. There's also information on intersex there and, what is the true numbers and rates of intersex. Okay, I will let you get back to your Saturday night and I'm going to go get back to my day. Join me next week when I have a conversation with Elizabeth Urbanowitz on her new book, Helping Your Kids Know God's Good Design. And so we are going to be looking at 40 questions on sexuality and gender for the littles. How do we have these conversations with our kids who are ages 4 to 12? Elizabeth is a good friend, but she's also a brilliant mind in having conversations with kids. And I am looking forward to that conversation. So I will see you next week. Have a good one, y'all.
There's nothing left.